Very much for coming to this webinar, and thank you to IHPA for inviting us to speak. I'd just like to introduce ourselves first. My name is Christobel Saunders and I'm a surgeon, previously at the University of Western Australia, but now at the University of Melbourne, Royal Melbourne Hospital and the Peter Mac. We also have speaking today Sarah Wise. Sarah is at UTS, University of Technology Sydney, where she's a health economist with the Centre for Health Economic Research and Evaluation. And we also have Julia Schulz, who is a program developer, program manager at GenesisCare, who's been very involved in this project. And we're going to try to explain to you today how we think we're doing some very interesting work trying to reduce out-of-pocket expenses and optimizing cancer care through developing a bundled package of care for patients with early breast cancer. Thank you, Julia, who's driving our slides. So this talk is, over the next 20 minutes, we're dividing it into 6 parts. I'll briefly talk about a bit of background and introduction, then hand over to Julia, who's going to talk about what this bundle actually is and how we went about developing it. Then Sarah's going to talk a bit about the actual evaluation and how we're going to be going about that and seeing what was successful and what wasn't. And we'll finish off with lessons learned and where to next. So firstly, a bit of background. Now, I do realise that all of you understand quite a lot about the costs of care in Australia. We do know that with cancer and with breast cancer in particular, we've got some fantastic improvements in survival in the last couple of decades, but there is still variation in both outcomes and experiences of care. And patients often experience a lot of complexity. They're lost and don't know where to go during their treatment. We also know that care is often expensive, and there are costs both for the health system, but also importantly, out-of-pocket costs for patients. Those out-of-pocket costs overall for healthcare are worth something like $30.6 billion each year, which are covered by individuals for both medical and non-medical out-of-pocket expenses. And we also know that the services that have the highest out-of-pocket costs include things such as diagnostic imaging, surgery, and radiation therapy, all things intensely needed by patients who have breast cancer. But the rates of those out-of-pocket expenses vary enormously between different providers, and interestingly, depending on where a patient lives. A couple of years ago, we did a global survey through a group called AllCan, which are a group aimed to look at improving efficiencies in cancer care. And we asked patients, and this was about 4,000 patients globally, what was really important for them to improve the efficiency and efficacy of their cancer care. And everywhere in the world, patients said the same 4 things came up most commonly. They wanted a swift, accurate, and appropriate diagnosis for their cancer. They wanted better information sharing, support, and shared decision-making so they had a say in their pathway of care. They wanted to see that their care was integrated and multidisciplinary, that there wasn't just lip service to those ideas. And then interestingly, from almost every jurisdiction, patients said that they wanted somebody to address some of the financial implications of cancer. So that's where we set off on this journey to try and develop a bundle of care based on some of these principles that patients have told us. Now, I know that none of the rest of you probably on this call are actually breast cancer specialists, so I just wanted to give you a 1-minute rundown of breast cancer. Breast cancer is now the commonest human malignancy. Well over 2 million women globally will be diagnosed with breast cancer, and a number of men, and that equates to over 20,000 Australians diagnosed each year, and sadly around 5,000 will still die of the disease as well. Most patients with early breast cancer, and that's breast cancer localized to the breast or the lymph nodes under the arm, will see a surgeon first, and often surgery will be the first aspect of their care, although some will actually have other drug treatments first. Of that surgery, around 70% of patients will have a lumpectomy or breast conserving surgery, the rest will have a mastectomy. And many of those patients will need radiotherapy. Virtually all who have a lumpectomy will need radiotherapy. And then virtually all patients will also need some kind of drug treatment. And whether that's chemotherapy, some of the new targeted agents, or endocrine therapy will depend on the pathology of the tumor. Patients will also require a lot of other services from, for example, allied health staff, nursing support, etc. So when we thought about partnering for this, we had to look at that whole pathway of care. Now, I'm talking here, we put on our slides UWA, and that was because that was my previous jurisdiction. I was a professor of surgical oncology then. So our group at UWA partnered with GenesisCare to try to really look at something we'd been interested in, value-based healthcare, and bring that into reality in the private sector in this country for people with breast cancer. And we wanted to both improve the outcomes, but also the experiences of patients. And we wanted to use some of those findings that I've just talked about in the All Can survey to do that. Now, this partnership was based on a foundation of a research project that's been running for the last 4.5 years at UWA called the Kick Cancer Project. And this is a partnership of a number of universities in WA as well as private and public health providers. And the idea is to try to bring value-based healthcare over a number of cancers into reality. We do that by defining standards and outcome measures. And we partnered with Genesis to really see whether we could look at a network of providers to establish some value-based payment models in the private sector. We've also looked within the Kick Cancer Project in the public sector. So from there, GenesisCare have been working very hard with the providers to try to develop this early stage breast cancer bundle that Julia is going to talk to you about in detail in a moment. And also, importantly, trying to establish what payment models that we could really utilize within this bundle of care. Next, Julia, thank you. So I'm going to pass over to Julia now, who's going to describe to you in detail exactly what this bundle is and how we're going about enacting this. Thanks.
Thank you, Christobel. So as Christobel mentioned, I'm the program manager from GenesisCare, and I've been largely involved in the design of this model and developing up the pilot that we're going to commence with in the coming weeks, hopefully. So the pilot, the bundle includes a 12-month evidence-based package care, and it runs from diagnosis of the patient to post-treatment, and it will operate in the private sector, and it will include a non-capped out-of-pocket cost to the patient. The aims of the bundle is to improve patient experience through navigation support and easy access to services that they would typically utilise that an early stage breast cancer patient would typically utilise. We aim to create financial transparency and certainty through having that capped and non-out-of-pocket costs for the full treatment pathway, and try to avoid any unknown costs that may pop up along the way. We're aiming to improve patient outcomes through timely access to services and knowing what the services that they can access are from the beginning of their treatment, and through providing support, so aiming to minimise distress and stress through those two ways, and also by providing transparency of the cost as well, which we know provides a lot of stress for patients when they're accessing treatment. And then also create a sustainable and scalable model, so something that we can pick up and adapt to new geographies and potentially other tumour streams as well as we go along. So the pilot will commence in Perth, and we are aiming to recruit 150 patients over 18 months, and we are aiming to test whether the bundle achieves its objectives. So the bundle includes, as I mentioned, all of the services that an early stage breast cancer patient would typically utilise through their treatment, and they can either be going through a breast conserving surgery treatment pathway or a mastectomy pathway. And so the entry into the bundle starts post the patient's first consultation with a surgeon, and then it can take them through staging, neoadjuvant chemotherapy if they require it, or straight into surgery, and it also will include re-excision. And then if the patient requires it, it'll include chemotherapy. If the patient requires it, it'll include radiation therapy. And then it includes post-treatment support, as well as allied health support right throughout. Patients can access allied health support from the moment that they enter the bundle. So that includes physiotherapy, a lymphedema specialist, clinical psychology and dietitians, as well as cardio-oncology. They will have access to Decision RT if they require it, precision medicine tools, as well as a patient navigator and a patient portal. So our patient navigator will have a connection with the patient from the very beginning of the bundle right through to post-treatment care, and they will be there as the patients exit their treatment. The patient portal is something that we're developing at the moment. It's in very light touch form, but the idea is that it will be used to support the patient navigator and the patient and provide sort of a one-stop app where they can access all of the information that they require about their treatment as they're going through. The patients that will be included in the pilot are early stage breast cancer patients, so patients that are diagnosed with stages 0 to 3 breast cancer. We're partnering with Medibank and HBF member insurers at the moment, so and members need to be bronze level or higher, and patients that are also treated at Perth Specialist Breast Care. So as I mentioned, we're working within the private sector in Perth, and so St John of God and the Perth Specialist Breast Care group are where patients will be recruited from. The proposed out-of-pocket costs for the bundle are $2,800 for a Medibank member and $2,500 for an HBF member, and patients will only pay for what they use within the bundle. So if they don't access the full gamut of services, they will be refunded. And how it will work is GenesisCare will be the fund holder and pays providers on behalf of the patient. So essentially, as the patient incurs an out-of-pocket, GenesisCare will manage that. And the idea is that this will save the patient from having to coordinate and manage individual payments over the course of their treatment, and ideally cause them very little stress as they're going through having to think about trying not to have to think about money at all. They'll also have the option to choose an upfront payment, so they can pay in full from the beginning, and we'll hold that money and use it as they go along for the payment of providers, or they may do a monthly payment plan over 12 months so that they can smooth the payment process. And to note here, in regards to the cost of the bundle, through our analysis, we've identified that a Medibank patient under the breast conserving surgery pathway would typically incur out-of-pocket costs of around $4,000, and a typical Medibank patient going through the mastectomy pathway would incur an out-of-pockets of up to $2,843 of out-of-pockets. So you would see that the out-of-pockets is not that dissimilar for the bundle and a typical patient going outside of the bundle for a mastectomy, but they also wouldn't get, outside of the bundle, they wouldn't get things like the patient navigator, precision medicine tool, and cardio-oncology, and the distress thermometer and things like that. So there are a lot of value adds for the bundle that are included. So in regards to the way that we work to develop the bundle, we aimed to create a replicable, scalable and fully costed program that could be implemented across Australia with trackable and measurable outcomes. So that was the idea in mind, and then we broke that down to design principles. So we aim to delineate and cost the pathways of care, establish best practice, including multidisciplinary and supportive care wrapped around the patient, provide patients with transparent costs and help in navigation with the aim to lower distress, and of course set outcomes and design measures to be able to report against the outcomes, so that we can feed back to providers how well the bundle improves overall outcomes and experiences of patients. So our approach in development of the bundle was defining the scope. So we worked with Christobel and the UWA team, as well as other providers, to define one, that we would go with early stage breast cancer, and two, what that looked like. So we consulted widely, we reviewed literature to define the evidence-based pathway. And then once we had done that, we defined the costs of the pathway, which I will not, it doesn't sound like much there, but it took a long time to fully cost the pathway and make sure that we had it fairly accurate to be able to design what that would look like for the bundle. And then once we had costed that, we decided what we could include and exclude that would provide patients with the care and support that they needed, as well as the bundle price. And we tested that with all of the providers that we were working with, as well as we did some focus groups with patients. So once we were happy with that, we got the feedback back and we were able to finalise the design and then confirm the providers and insurers that would be participating in the bundle. And once we've done that, we're in the process of preparing to go live. So setting up the people, systems and processes to enable the bundle. And we'll say we're quite close to launching, aiming to do that before the end of June. But we will, and hopefully we will be able to report that when we do the Q&A session. So when we were doing the testing with the patients, we were able to get some really great feedback from them. Many have said that having clinical psychology and support of a patient navigator would have really been helpful as they were going through, knowing that they could access people to talk to navigate the way that they were feeling throughout the treatment, and also just having allied health so that they could access it early and understand it early on so that they could get it before their symptoms got worse. Again, then also understanding the out-of-pocket costs would have really helped and ease a lot of stress. And many have said how stressful it was managing costs and things like that. So we knew that we were on the right track when we did the testing, and we've continued to consult with patients as we've developed materials and the rest of the bundle and gone along and continued to get that great feedback, and also from a lot of providers and insurers as well. So I will hand over to Sarah, who will take you through the evaluation and design of the evaluation of the bundle.
Thank you, Julia. So we have the terrific opportunity to be involved in this very unique bundle of care and new way of paying for services in Australia. And the terrific thing is that they've brought us in right at the beginning rather than trying to evaluate it when it's all done. So the evaluation has actually been co-designed between our team at UTS and Christobel and Genesis and the Kick Cancer team at UWA. And it's been designed against the bundle objectives, which in themselves hit the key aspects of value-based healthcare and across a full cycle of care as well. Because what's really unique about the bundle is that it goes from diagnosis right through surgery and post-surgery treatment. So it's much longer than anyone else has attempted before, and it gives us an opportunity to explore the sort of experiences and changes over that period. So in terms of the main objectives, the details are there, but essentially we're looking at financial sustainability, because Genesis is taking on the risk by setting a capped price. Genesis is taking on the risk of patients exceeding that capped price. So this pilot will be able to evaluate whether the price is correct, and also it will allow us to have a very detailed look at the profile of patients and the risk adjustments that might be needed in the future. We will be looking at the health outcomes that matter to patients, because these patients will have improved access to psychological support and to other forms of supportive allied healthcare, as well as some of those additional services that have been designed into the bundle. We'll be looking at patient experience, particularly the navigation aspect, because as Christobel highlighted, fragmentation of care is a real problem for breast cancer patients. And also provider experience, because one of the major challenges to changing how care is provided and paid for is provider buy-in. So we'll be exploring those issues. Now, because that's basically everything there is to do with providing care, we require an awful lot of data. Have the next slide. So we're collecting data from patients, providers, and the bundle administrator themselves. The figure there is for the patient data collection. And we're very fortunate in this study, not just to be evaluating a full cycle of care, but also that we have a comparator group of patients whose data we can access for many of the elements of the data collected. So that cohort 2 is are the KIT cancer project patients. They're already recruiting. They already have 80 people in their study and will be able to access that data. They are receiving very similar care to the bundle patients, but they don't have the patient navigator, and they don't have that sort of wraparound care with all the allied health services. So we will really be able to evaluate whether it makes a difference on those elements of data where we have common measures. So those common measures are the PROMs, and we're using the ICHOM standard set and the EQ5D for those, and also the clinical and much of the service use data as well as the PREM. So that's the patient quantitative data collection. Within the bundle, we'll also have some more detail around the MBS and PBS, as well as the bundle program data. So those are the costs to Genesis themselves, such as staffing and admin, complaints, and all the program documentation. So we will also be doing qualitative interviews because the quantitative data can only tell us so much, especially in terms of experience. We'll be interviewing patients from both cohorts about the experience of their care, both with a particular focus on those sort of fragmentation and sort of integrated care issues, as well as the sort of financial stress and their overall experience of their care. And they'll just be conducted at the end of the pilot. For the providers, we're going to be interviewing those clinicians at the start of the pilot and at the end of the pilot. And the interesting thing we'll be exploring there is their motivation for getting into it, what they expect to get out of it, and the things they're concerned about, and then we'll be able to get them to reflect on their experiences at the end. We'll be interviewing the insurers and the bundle administrators again to see if this is a viable model going forward, and the experiences of actually administrating that care. So that's all I have to say about the evaluation. I'll now hand back to Christobel, who's going to talk about the lessons learned.
Sorry, on mute. We're almost out of time, so we're going to very quickly run through the lessons learned and wrap up. So these are, I think, really important things if you think about trying to do this in another area. These bundles are very specific to geography. So this will be different in Perth than in Melbourne or Sydney or anywhere else, and of course different between different diseases and different providers. But it's really important to connect very early with providers, to bring them along on the journey, to make them see that the idea of really delivering great care at a great cost to patients is important. Working through the financial aspects of the bundle was much more complex than we thought, as Julia mentioned, and sometimes it was odd things that you would never think of, you know, some of the diagnostic imaging, some of the pathology, all sorts of things that you wouldn't necessarily think of first up were important to, and so you have to know people who intimately know the clinical journey so you can really get all those financial aspects correct. Of course, collecting all of those outcome measures and financial measures, as you've just heard from Sarah, that's going to be a big task. And having a good electronic medical record is important. But remember, in the private sector, that's often lots of different records in lots of different places, in people's rooms, in the private hospitals, in path labs, etc. But already the good news is that looking at this holistic end-to-end pathway is highlighting some great opportunities for improvement. For example, we've realized that we can do better looking after the patient's drains post-mastectomy or post-axillary surgery at home. We've realized that early engagement with psychologists will really improve the patient journey, other allied health providers that are important to the patient. So I'd like to finally pass over to Julia for the last word on where to from here.
Thanks, Christobel. So following the completion of the pilot and undertaking the evaluation, we plan to share our learnings broadly with the sector and work with other industry bodies to see where bundling can take us. We believe that a lot can be learnt from this and we really hope to work in partnership with a lot of you potentially going forward. We hope to continue to run the bundle in Perth and expand to additional providers. The success of the bundle relies on being able to give patients choice. And so we really hope that we can expand that pending the success of the pilot. And then also beyond that, we hope to expand to additional geographies across Australia and potentially into America and the UK where GenesisCare operates. And also look at different tumour streams and care pathways where we can create bundles to improve patient experience and overall outcomes. So that is the end of our presentation. Thank you very much for joining us today, and we look forward to receiving your questions over the next few weeks and attending the Q&A session on the 29th. So thank you on behalf of Christobel, Sarah and I.